appreciate your time. I think we've crafted not to brag on ourselves, but I think we've crafted a really fun and interesting webinar for you all today. And we hope that you find it useful in your work. Let's go ahead and switch to the next slide. We're just going to do some really quick housekeeping. As you all know, as is typical, the webinar is being recorded. We ask that you please don't use a speakerphone and don't put us on hold if you're using a handheld telephone. If you are on your phone, please mute it when you're not speaking. You can use the mute button on your own handheld, or you can press *6 to mute and then *6 again to unmute. If you are just on your computer audio, please double check and make sure that the little microphone in the Zoom lower left-hand corner is checked off. We would very much appreciate it if you can leave your video camera on so that we can see one another and really feel like we're together. But if you are zoomed out and you can't deal with looking at yourself or anybody else for another minute, please don't hesitate to turn your camera off. We understand completely. If you have any technical issues, please go ahead and send them to Jessica privately in the chat box. She will do her best to help you. Here's Jessica waving to us, thank you. If you have content questions though, please chat the whole group so that we can all benefit from your questions. If you're wondering about something, odds are somebody else is as well. This is really designed so that we can impart some information to you, but we also really want to learn from and with you all. So discussion and participation is essential. Please don't hesitate to jump in at any time with a question. You can do that auditorily, or you can also do it via the chat. Let's go ahead and switch to the next slide. If you have called in on your telephone, it helps us enormously to be able to link an individual person with their telephone number. So if you could bind the telephone number that you're on with your computer, we can more easily identify you. In order to do that, you will click on pound, participant ID, and pound on your phone. And if you have any trouble with that, getting that to work, Jessica would be more than happy to help you out. Let's go ahead and switch to the next slide. So I'm going to turn it over to Bethlyn now, who's going to lead us through a brief check-in, and just want to say again in closing, thank you all very much for your time in joining us today.
Okay, hello everybody. So we're trying to find ways that we can connect and really hoping that we can just very briefly, we did this last time, and just as we keep going, if you could all throw into the chat, this time it's one word to describe what you are excited about for spring. So it could be 2 words. Don't get hung up on that. Yeah, sun, thank goodness. Vaccination. Yes. Oh, the warm, oh, the blue bonnets. Yeah, we have some crocuses coming up. Ice cream. Yeah, being able to see people and be outside and knowing that no snow, T-ball, long walks. There's so many good things to look forward to. Bluebirds, life.
Hi.
The celebration of life.
Yeah. Can I come in there?
Hi, Debbie. Are you here?
I'm sorry. I didn't realize I was unmuted.
Oh, it's wonderful to hear your voice.
I'm really sorry.
Welcome.
I was go in Josh's room because Josh expressed that he doesn't like that I have so many meetings and I'm away from him all day.
Yeah.
So I was just going to go have my meeting in his room.
Oh, that's wonderful.
So
Good.
that's what I'm going to do. So I'm sorry. I didn't realize I was unmuted.
Not at all. Well, go get comfy and
okay.
Welcome.
Okay. Thank you.
All right, everybody. So we are going to, I appreciate everyone. Keep chatting. Anything else comes to you, I'm sure other people will enjoy looking through and seeing what's coming through and relating to what we can get excited about. So I'd love it if we could go to the next slide, please. So we're going to first talk about, we're going to start with just laying out there. We did that pre-work to just raise up thoughts and considerations. This is really, really workshop-y. Like it really is about wherever you're at, let's talk it through. So we're going to start with that until 12:35. And then we're going to have a state team spotlight. Team Kentucky has really been honing in on their impact statement and considering how to approach it and what to do. And we were really grateful that they were willing to just share from wherever they're at in their process and to take a deeper dive, similar like an ECHO, there's a case presentation. So we'll take a deeper dive with them and be able to give them some feedback. And hopefully in that process, it will also help all of us to consider things on a more practical level in the work. Then we're going to talk a little bit about weaving the data together to make it pop. So we've got a few things we want to share with you. And then as we look to our final months together, we wanted to give you an overview of the remaining technical assistance, deadlines, deliverables, and that kind of thing. So that will be, we've devoted a little bit of time at the end for that, as we know that that is something that folks are continuing, we all are continuing to wrap our heads around, and we want to give you where we're at that. So that's it. Next slide, please. So here we are, collective crafting of your impact statement. When I was thinking about this, two things came to mind where people might be at. The idea I think here is like with Michelangelo, I saw the angel in the marble and carved until I set him free. You may have an idea of what's in there and you're just trying to like let it out. So it really is a crafting. I don't think that this can really be considered something that's a science. It's really more of an art form, and you feel your way through it and we talk our way through it. So that's what we can do together. And then there may be some that are feeling Michelangelo-ish, and then there are others maybe more the beginners. Below is like a beginner clay class, and let's learn some skills and techniques you can use along the way. And wherever you are at, that's what we're going to talk about, because there are going to be pieces here for all of us in this collaborative. It's the power of the collaborative that we're bringing to bear in this conversation through this journey that we've had together. So we want things to be tangible, practical, and relevant for you. We know everyone's overwhelmed. The pandemic is insidious. It continues. I think it just wears. And it's hard to think of coming towards the end of this and what that might mean and where we're at. So we want to make this as pain-free as possible and just let you, it's okay. It doesn't, wherever you're feeling about this, the idea is that we're just gonna have the chance to really, I'm kind of excited about just, this is the fun part, and to talk about what you know you've done and how do we help share that out and talk with each other about it. There are a few things that we've done prior to this that I think would really come to bear here that might be worth looking at. If you haven't been involved in the Care Coordination Academy, they had a half-day meeting recently where they had Medicaid directors, medical directors on a panel that talked through, essentially it was building relationships, but it was within the context of finding that message and sharing that story and drawing people in. And giving them what they need to be able to go ahead and move forward. It was really, I think it could be a very instructive conversation to be able to listen to. It's not all, the whole thing isn't 4 hours and you can fast forward through things. And you could also get CEUs for reviewing that. Another thing, our last webinar with Ryland, she did an excellent job framing some of this and helping you to step back and consider the larger picture of it. And now we're going into the details and the practical and what does this look like for each of us. And we're also going to create a sustainability folder so that we can all share together as we have things that we're working on. And it really, this is like the clay there. It really is coming to form. So, so we will, I see that there's some stuff in the chat, and I know that Jessica can speak to the Care Coordination Academy materials and help give more information on that. So if we could go to the next slide. Also, I think if you have anything you want to say or throw in at any time, please feel free to. I see that we've got welcome to Josh. I also just want to welcome, we've got a whole group of people here. This is like a fertile thinking ground. We've got all of you who've been on this journey. We've been on the journey with you. We've got representation from IP. We've got our AMCHIP. We've got our family voices. And then we also have NAC members who are here. I haven't gotten to fully Steve Fitton, who helps with the fiscal piece. And then I just scanned the list a minute ago. So if some others may have joined, but Amy Houtro is here, Ed Shore, Rylan Rogers. And then Kara mentioned, welcome to Josh, who may have some ideas. So it really is truly, if you have questions of someone, just ask. If you wonder something for the group, ask. It's really like shared facilitation and just thought partnership together. So this is the impact statement elements, which I think we're all becoming familiar with. I just thought we'd throw them up here. This is what we're trying to do, and it is a lot harder than it seems, right? To be concise and get specific and try to put it all together in trying to do it in one page is is the guideline here, because people that you want to share this with need to be able to get to the bottom line. Next slide, please. I also just want to mention in doing this work, it's a twofer for you, and like it's going to help you in getting to that bottom line and drawing people in, but also we'll use this as the first page basis of the final report to HRSA. So we're hoping that this is actually a working document and a working process that helps you really helps drive your work in trying to look at the next step moving forward in these final months. All right, so if we could, the one other thing I wanted to point this to is that it's like a test kitchen. So we have all the ingredients and you want to start seeing how they fit together, and who knows how it's going to turn out, but we can all reflect back to the group from the group and give you some ideas. Great. So what I would like to do is just start with the first question from your pre-work and open it up to everybody. So there's always someone that's ready to get going, and we'd love to hear from anyone. Just starting with, and this may open up to anything, we could go in any direction with this stuff. So what is the top question you are trying to convey in your impact statement, and to whom? So this is that talking it out process. So we'd love to hear from anyone that would like to start.
This is Rhonda from Minnesota. I would say just the power of collaboration across all areas. We've got the collaboration with our parent advisors. That right there is key. The collaboration with all you is key. So there's just so many, to me, that wants to be I would like that to be one of our top messages.
Great. Who do you want to share that with?
Yeah.
Do you think that would be, who is the audience in your mind?
Say that again, Beth.
Who is the audience in your mind for that?
Well, so for that, I would say it is internal and external.
Okay.
I would say that's across the board everywhere.
Okay. So when people hear Rhonda say that, what other questions or thoughts do you have when she says that?
So Bethlyn, one question that I have and that I'll talk about too, because I think Rhonda hit it on the head. You've got your external and your internal. So there are certain people for us, because we're a state agency, that we are, I'm not going to say dependent on for funding, but they're the ones that kind of feed us. And so part of this statement, the impact statement, needs to be directed toward them. So that's more of the external. But at the same time, internally, for just the people in the Office for Children with Special Healthcare Needs, and bar none, the children that we serve. I mean, they are actually the audience, the main audience. And then we have to figure out a way to reach the people that help us fund and do what we need to do to offer the best care, if that makes sense. So how do we do that, Bethlyn? Rhonda, how do we do that?
You've raised some good questions. So I hear you saying, first off, that there's the power of the collaborative, both within the context of these interprofessional core teams that you've created for your teams. Then there's the power of the learning collaborative across teams and having that come together, and that their audiences are external and internal, and it's including the people that the children and families that we're working with. When we ask that question, how do we do that? I'd love to hear what people's thoughts are. Amy, you said internal, external. Do you want to speak to what you have there? The messages might be different.
Yeah, so I really appreciated the idea like, oh, if we're talking to the people that feed us, right, or who can actually give us resources or funding, that kind of message is really needs to like hit it home. What's the benefit? What does it mean and why it needs to be funded, right? But the message that you might give to the people that you serve or your communities needs to be in language that's really accessible to them and meaningful to their lives. And so that might be a really different message. And it also might be delivered in language or graphics or ways that would be different than how you might deliver that message to the key to the castle kind of people. So I think it's a really hard thing to have one document be all things to all people. But I think part of the how has to come from the why. And so if the reason why is we really need them to know that this worked and they should continue to fund it, then I think it helps us shape the how we deliver that message. And of course, we've already now started to talk about the who. This is a big, huge topic, and I really love the kind of thoughtfulness about how to think about it from those different angles.
Thank you, Amy. I agree that we're not going to do it all. Like it sounds like from what we're saying, one impact statement is not going to get us everywhere. And the data you highlight and kind of showcase the impact you showcase may be different in particular, depending on who you're looking to, and the form of it may be different. I don't think you're going to want to give a one-pager out to your families per se. That might be more visual representation. And I know this stuff takes work too. And that's part of figuring out how can we do this as smart as possible so that you're kind of who's the person that feels it, like it's like, oh my gosh, yes, I know the message. I want to be the one to try to give us something to react to. We can just create one PowerPoint that kind of whatever lays it out, someone that feels like they could make that happen, and help to do the piece. Like we've been creating infographics, and there's a lot of software out there that really actually helps you to set up those images and make things look kind of sleek. And some of you in larger places may actually have like a public relations place that could help with some of that, but that takes time too. So one of the things that occurs to me is to really, even though it's all needs, to prioritize and parcel out. So there's the ideal, and then there's the good enough. And where do you need to focus, and really be clear about that for yourself so that you can take your time with what is the next place that you know you need to go in order, for instance, to be fed and continue with that. There's a lot of comments happening in here, so I want to stop talking. Trisha said, I think everyone's going to want to know how the collaboration works. So what's the impact? If we're saying that collaboration is key, how do you articulate that it is key? Rhonda, I don't know if you want to talk about that for a moment, how you think you can articulate that, just even talk it through if you haven't thought about it yet.
Well, since Nikki's from Team Minnesota and she has her hand up, I'm going to pass it off to her.
Perfect.
Just to get her question and then kind of answer your question.
There are things I'm not able to see, so anyone should jump in. I'm looking at the chat and looking at so please do that.
Thanks, Rhonda. I was just commenting on, the top message you're trying to convey in your impact statement and to whom. My first thought is authentic and valid information, which is what I've received from this experience. It's all been authentic. It's all been valid. It's all been providing a safe platform for the collaborative to come together and make sure we have the information we need to move our families forward. Because each of us take a piece of this with us on our day-to-day in our personal lives and with our work lives and the hats that we wear and the positions that we show up with. So you said, whom is it for? And I say everyone.
Yeah, I really like the way that you're talking about. I think there are certain foundational messages that you can weave in that will appeal to anyone. And Meg's going to go into this a little later, and you've heard it before, but just how you rely on that lived experience, that piece that people carry around, and what we've all carried around. There's something, I know every CoIIN probably thinks they're special, but there's some truly awesome things that we've been able to do in your teams and the commitment you've had, and in the collaborative, that have touched us in ways that matter, that have manifested in the world. So there's actual impact.
Right.
And
if you don't share, no one knows.
Yeah.
That's the problem. Like, you have to have an open platform and open facilitation. So you're looking at funders, and why is this important? Because we've actually opened the door and given space for people to be able to tell their story so people can learn, so we can pull from that and figure out how to help.
I love the way that you put that. There's a lot in the chat, and I would love if anyone wants to help support in pulling things out and considerations of any other thoughts, questions. Rhonda, do you want to speak to the how of the collaborative? Are you feeling like you speak to that? All right, then we'll.
I have a question.
Yeah.
So in the information that you sent about the impact statement, it noted that it'll be the first page of our report to HRSA. So how do we balance knowing that this is going to HRSA with who the audience is, and would they be the audience for our first impact statement? And I can see how different audiences we'd want to tweak it to make it meaningful and relevant. But for this one, how should we approach that?
So I'm going to then defer to Meg. I'll give a primary answer, my initial thoughts, and see if she'd want to add anything, or anyone else, because this is, I mean, we've all, I think many of us have had our experiences with HRSA along the way. This is my first grant with them, but I'm in the public healthy realm. So because you obviously are aware that their state team report, there's content and questions beyond that initial page. So the idea truly is we were trying to find a way to say, like, all right, how do we not duplicate work and allow the teams to use that impact statement? So I would like to see that you choose how you are using that impact statement, and it ends up serving two purposes for HRSA. They get to see how you are crafting your story towards engaging stakeholders, or whoever that stakeholder may be. And then you can use the rest of the state team report to be more specific to HRSA. So I would really like to see, I think it's primary that you craft this for your context and to be able to be authentic to your project and where you think you need to go next and who you need to engage. And then the rest would be, you could even speak to how you pull out the different elements that you would want to elaborate on for HRSA in the context of the rest of the report.
Thank you for the clarification.
Meg, would you add anything to that?
I see Pat Bailey's hand is up, so I just want to say a sentence or two. I think one of the ways you could think about this is the impact statement is your foundational document. And then the way that you craft different messages for different audiences, it's the same content, it's just shared in a different way so that it works for that audience. You might emphasize something, to one group, you might emphasize something different to another group. You might use different modalities. You might use your journey map. You might use an infographic of some kind. You might use a written report. You might use a brief of some kind. You know, there are all kinds of different ways that you can push out that message, but your impact statement is kind of the foundation. And that, I think, is really important because you want to make sure that you and your team have consensus about what your impact was so that you're all speaking from the same playbook, for example. But the way that you get that message out can be different. I hope that makes a little sense. Let's go ahead and let Pat get in with her question or comment.
Meg, pardon me. I was trying to send a message to disregard my raised hand,
No
but
worries,
it would not send.
no worries, Pat.
My
Thanks.
point has already been made, so
Great,
thank you so much.
thank you.
All right.
Oh, Bethlehem, this is Stacy in Alabama. I'm
Stacy.
sorry I don't have my camera on. I'm homesick, so I didn't want to show everybody what my sick face looks like. But I just wanted to highlight the infographic concept. We're actually meeting as a team later this week, but I was trying to think of ways to foster our discussion for our impact statement using the instructions that you sent out, but I created an infographic to foster that discussion. And in the center of it, I put partnership, innovation, and caring. And then out from that center, I highlighted things that we did that fostered those three things throughout our project, and thought, well, who is our main audience? And I know one of the audiences that we're focusing on is other physicians' offices in the state or different clinics where we might want to spread the CoIIN model. So I really just highlighted aspects of that. But I think the infographic is a good starting point to me to foster those discussions among the team. So I can let you know how it works after Thursday.
That's great. I think that's such a creative way. And for ourselves too, that might be a way to kind of test out visuals, see how it works for you all, and it helps in our process for being able to see how the pieces work together. And how do you think what did you highlight because of the audience that you're looking at that you particularly tweaked it for?
I highlighted that we built relationships among the families and to improve their quality of life. And I highlighted our partnership with Family Voices to enhance family engagement. The focus groups, again, highlighted those because they strengthen family engagement. The shared plan of care that we developed and how many families that we serve through our care coordination efforts. And then we provided care notebooks and educated the families on their use. So I wanted to put some numbers in there. So I highlighted that aspect. And then I want to insert a patient quote and a physician quote. I think it'd be really good to have a quote from one of the physicians at USA. And of course, there's a little paragraph that highlights what our purpose was in the project. I didn't have fancy software, but I think it looks pretty good.
Yeah, you can do a lot with you don't need as much. And even we had students that were working on infographics for us. They just Googled infographic templates and they look amazing.
It is, yeah. There's a lot out there.
If you would be willing, we would love if you could share that with us. I think that could be helpful as other folks are thinking this through. Would you be willing to do that?
Yeah, I can.
Great. It was Canva for the infographics. Anyone have anyone else? I'd love to hear what other people are thinking. If you have any thoughts or questions, even for Stacy just shared kind of how they're thinking of pulling out their work. Is there anything that occurs to you that could be useful for them as they think about how they're crafting their story that you might want to ask them more questions about based on what she said, or anything you'd add?
Well, again, this is Rhonda. My big aha moment when I was talking to Mary Webster a few weeks ago was like, ding! Yeah, I'm the mindset of a researcher, and this impact statement just totally threw me. I had no clue what we're supposed to get across. I'm like, duh. Okay, this is like if I'm writing a manuscript, it's that first section, that first paragraph that highlights everything. It's your results and your discussion. I mean, so viewing in that context made it a whole lot easier for me. So I don't know if that would help anybody else who is struggling.
Yeah. That's great. And I'd love to hear if there's anyone else that's having trouble wrapping their head around it. Is there anyone else that's just, there's something you're like, I'm just trying to get how to think about this and how to consider, and this is tripping me up.
Beth, and I'm not sure I'm answering exactly that question, but I think as we have been thinking about this, our statement is, how critical it is for families to engage in their medical and surgical experience. That's the statement. And what we realized is that, as Sarah Perkins said, there ought to be a plaque somewhere in the Boston Children's Hospital that says that. And there might be, but I don't know where it is. And so what our aha was, I think, in thinking about this, is how important it's going to be to have those statements by families as the key message because our audience is the medical center. We're all doing this, but it's sort of inside people's heads. It's not in a way where there's a sensory impact of seeing a plaque and hearing the voices and so forth. And so that's the way we're going to try to craft this. And of course, it's part of our kind of mission to expand the way in which family engagement happens at the hospital. I don't know if that makes sense.
No, that makes a lot of sense. It's something that's living as opposed to a plaque, which, and so it's manifesting. And how do you articulate and share that? And that's really, I think, a fantastic. I got a yes. Don't let me forget this. Rhonda said. I like that Judy said sensory impact. You got some comments there. Any other thoughts on that? People throw into the chat. I'm sure they'd be very helpful for them to hear as well. And I do want to point, Debbie Harris said something I think is really an excellent thought. And before we move on to the next section with Team Kentucky, Debbie, would you want to speak to what you said? I think it's a critical point and very thoughtful.
Sure. I guess I'm just saying this, just recognizing that sometimes when I've been speaking panels or whatever, we've kind of repeated our message the same way so often that I've watched the audience kind of fade. And I know that it's easy to kind of just get a message kind of in our minds and in our hearts and put it out there for a particular audience. And I've done this myself so much that sometimes I hear myself repeating my story and I just do it without even thinking. It's kind of like it's muscle memory in my brain.
Yeah.
And even now and then I will actually throw in a diagnosis that my son doesn't even have. Just because I'm not even thinking. And then I'll kind of laugh because I'm like, wait a minute, he doesn't have that. And then the audience is like, why is she laughing? That's so inappropriate. But I think that we just get so used to this, like, because we're all advocates and we do this so much, we're so used to it that it just is part of us. And so I think we have to be careful to constantly refresh what we're saying and to also speak to the moment and what's critical at the moment, because that is, I think, the key to engaging the people in front of us. So.
Oh my gosh, can we just take that and put that on a plaque? Speak to the moment and what's critical in the moment, because that's how we are able to engage the people in front of us. I think that that's really what we're trying to do with this impact statement. So I think that the way you just put that, and I think that one of the things that we've realized through the CoIIN, and Meg brought this up and it's come up through multiple different people in the context of what they were sharing about their impact statement, is that part of what will make this work and live is having the different perspectives that are contributing to it. And that infuses it, and having the step back so that you are in fact taking this time to step back and realize what you've accomplished, what you've done, because it does live, and you do become like almost immune to some of it. It just becomes what is. And we can help with that. So 2 things I want to say is that we can distinctly help just pull out, like, here's what we see that you're doing. Here's what we see. And have that step back, and the coaches could help with that, but it might be good to get that from others as well. And the other thing is, we would like to look at crafting out of this conversation and moving forward more of a universal message from the CoIIN overall, because the more we can do that on behalf of children with medical complexity, I think the more it will give us all a basis for the work, and that is the power of the collaborative. We need to move on. So I am going to hand over. Yes, what might not have worked. This is a quality improvement project, Jill. And that can be extremely instructive for other people. So I'd love to hand the floor over to Team Kentucky. What we're going to do with them is we've had a conversation to kind of start grappling with some of how are you approaching this and doing this within your teams. And I know there are many more stories to share. If anyone would like to just put, just for the sake of everyone to see, some of your particulars, what you think your statement, like what is your main point you're trying to highlight, you want to throw that into the chat. We'd love to just see that and have people be able to recognize that. In the meantime, Team Kentucky is going to take a deeper dive into their impact statement and ask you for your input in areas where they're still figuring some things out. And we are very grateful for them being willing to do it, and just have it be an open space. I'm excited. Thank you.
All right, so Team Kentucky, and Meg just pretty much hit the nail on the head on what I am going to ask of everyone for their input is, how do we determine if we have failed or not? Because that seems to have such a negative connotation, but actually it is a way to learn. So anyway, so we'll start. So Team Kentucky, building better healthcare outcomes. Next slide. So this is our team, and I think it's important to kind of give you the background just to know where we are as we look at what we've accomplished and what we've not. I've been on the team for 1 year and 4 months, 5 months now. Sandra Gilbert has been on the team since the inception. Ivy has been on the team for probably since April. Jonathan Borden has been definitely helping us all along the way, but has taken a more robust participation. And then Zachariah just joined us recently. So we have gone through quite a bit of change in terms of not just the leadership with the Office for Children with Special Healthcare Needs, but the participants in the staffing. And that has made a huge difference in, I think, how we've approached it. So keep that as your lens as you're looking at it. We have not all been a team that has been cohesive for the last 4 years. I would say we've been a team that's been cohesive for at least 1 year, maybe 1.5 years now. So next slide. Just to give you an idea, and we've talked about when at our virtual meeting, but it's interesting, and again, keeping it in the lens as we look at why we even got involved with the CoIIN, because Kentucky does have quite a few rural areas. The Office for Children with Special Healthcare Needs does have, as you can see, multiple locations where we actually still see patients. And so we're a little bit of an anomaly in that we're a state agency. And so we have some clinics that just see patients, but then we also have some that are considered hybrid clinics where we bring in providers. So there's quite a few different ways that we are able to service the children throughout the state. Next slide. So this is, we try to use our journey map wherever we can. And for a little bit of levity, when I first saw Rhonda Katie's journey map, I instantly picked out it was her, because Karina did such a good job. I was like, oh my gosh, that's Rhonda Katie there. So when she did ours, I told her she had to put my freckles on, whether anyone can see them or not. it made me feel that at least I had some semblance of there I am, because I thought Rhonda's was superb, the caricature that Karina was able to do. But we've tried to use this, we've shared it with, because when we look at where we are, we're under the Cabinet for Health and Family Services for the state of Kentucky. And so we are smaller compared to everyone else, the Department of Public Health, Medicaid Services, Department for Aging. So we're just a small entity comparatively speaking to everyone else, but we do so much. So again, we've been trying to share our Team Kentucky journey map so that people can get an idea of what we're doing and what we have accomplished. Next slide. So this is how our initial project started. We had 4 arms. This project was actually initiated by one of my friends who was in the position of medical director prior to myself. So this is how she envisioned it. And then I came in, and by that time, things were just a little bit different, and it was difficult for us to bring forth the aerodigestive clinic as well as support for children with ventilatory requirements. So we have honed down and kind of pared down our QI project to the infant complex care clinic with the University of Kentucky, and then our virtual care team conferences, which really is, again, where we bring providers together with the patients and the parents and have kind of a virtual team meeting and making sure that we reduce redundancies in labs, redundancies in surgeries, anything, really just to offer better care coordination. And that's important to kind of keep in the lens also, because now this was pre-pandemic. This was pre when everyone was Zooming, and now everyone Zooms and everyone's having a virtual meeting. So one of the questions I have, are we relevant with our virtual care team conferences? Because the world has changed, not just from the time that I came on board, from the time from the pandemic. And so that has really changed things up a little bit. So next slide. So our biggest accomplishment, and it's hard because there's some things that I think, oh man, this is really big, this is good. But I think our ability to improve on, as I said, various initiatives, which really centered on what we've been able to do with our telehealth at the Office for Children. So that is what I would like to be able to highlight on my impact statement. But at the same time, there are other things that we've done, and going back to what Rhonda said, especially the collaboration that has occurred, that has been immense. And it is not just collaboration with the CoIIN teams and with BU, it's amongst ourselves. We, as a cohesive unit, the Office for Children has markedly improved our ability to collaborate with each other and with various departments within our office. So that has been huge, and part of it has come together with our telehealth program. Next slide. So if we look at, again, going back, Beth Lynn, what is our message and what is our audience? So we've talked about that. So our project goal was to improve healthcare outcomes for children. And I think that's what all of our thoughts are. But it goes back to, what do I consider the targeted audience? Is it going to be Ocean? Is it going to be the staff at Ocean? Is it going to be state leadership? Is it going to be the head of the cabinet? Is it going to be Governor Beshear? I mean, who do I decide is the target audience? And I think we've talked about that a little bit. And Beth Lynn, did you want me to stop in case people want to add something, or go through the slides and then people can add? How would you like for me to make this work?
Oh, we can't hear you, Beth Lynn, I don't think.
Sorry, my children came home from school and I muted myself. I think however folks want to do it, I think if anyone has some thoughts right now and they want to throw them out there, would you want to just say what you're thinking in terms of what you're asking here, Pat, from the group?
Well, I think it goes back to what we were talking about, and I think Amy had touched on it, is how do we determine our audience in terms of who is going to be, who do we want to reach, and why do we want to reach them? in terms of what are they going to give us back in terms of what we're going to give them.
So do you have an initial idea about that? I guess that's, if we start with that, people might be able to then help give input or other thoughts that might be useful to you.
Well, I think we're going to have to definitely the cabinet, and for us, it's going to be state legislators.
And why would you say that?
Because the state legislators approve the budget. And while we're a Title V agency, we still have to adhere to what is in the budget.
Got it. Yep. Money makes the world go round. What do other people think when she's talking about audiences and you hear her speaking about telehealth as their primary project goal and improving those healthcare outcomes?
Well, my always first thought when I hear improve healthcare outcomes, that's really hard to not only do, but quantify. That I know legislators are concerned about money, but I feel like our focus was more important. It was quality of life and well-being. And by doing that, that's like the underpinning to me. That's like the foundation to everything. And then supporting that foundation, which is the family unit, we can then build all the other stuff, if that makes sense. But I'm not sure how you get that into language that legislators understand. That's the...
Rhonda, I really appreciate that, because you just gave me a really good thought, because I do think if from my years of advocacy with the Academy of Pediatrics, definitely legislators like a story, and they like for you to hone in on something that's more personal. And we just talked about how maybe having, I think Stacy talked about with Alabama, having some verbalization for maybe parents or physicians or people that can talk to and speak to how this has been good. That might be a way for us, Team Kentucky, to include some of that as we put our impact statement to, again, because you're right, the data is what's the hardest. As I look at this, how can I have data on telehealth, I have data on what we've been able to do, but as I tried to find out, okay, well, if I do telehealth and I hone on that and I say, okay, I want to prove some data. Well, definitely it eases life. It does make things easier. But then we look at, okay, how are we saving gas money? Well, how do I determine that? Are we saving time? How do I determine that? Do I say, okay, it takes you 15 minutes to get to my office, and then it takes you an hour to pack everything up? How do I do all that? So you're right, the data that sometimes state legislators want to see is very difficult for me to parse out, for us to be able to parse out.
Yeah, and we've thought of that story. You each have engaged patients to your interventions and providers and family leaders, and you have places you could call those stories from that really anchor the impact. Did someone else want to say something?
This is Maureen from Texas, and forgive me for always having my cynical hat on, but if I'm and not all state legislators are cynical people, I know, but of course, if I saw a statement like this, I would say to myself, well, of course I want to improve health outcomes for children with complex medical needs. You know, what monster wouldn't want to do that? But then to be able to make the case, but then have I made the case that it's imperative for you to put resources behind this? Like, sort of, that is my writing an impact statement. That's what I need you to do. That's the case I need to make. Of course, I think they would all, who wouldn't agree, yeah, that's a wonderful thing to do, but how do I make it imperative that you continue to commit resources? And to me, that's hard. It's hard to get that in one page. It's a tough sell.
I think that is a primary question. When you ask that, Maureen, do you have a thought about it? Does anyone else have a thought about it? Because I think that would help everyone to hear where everyone's at with thinking about this.
I think we're starting to get into return on investment territory here a little bit, which is not a bad thing, but it can be complicated and difficult. It can also be relatively simple because it depends on who your audience is. It depends on what their needs are, and it depends on their tolerance for or attachment to what they think of as hard data. So, there are some folks who will dismiss qualitative data because that's just a bunch of stories. There are other folks for whom, if you're able to make a case that seems reasonable, they're good with that. And in my experience, state legislators, they're not folks who don't want to do good. They need a reason in order to be able to do good. And so, creating that story about what the value case is for what you're proposing and what the return on investment could be for those resources, I think is something that's really important and something that we can give folks help with in constructing their impact statement, because a lot of it is very individualized.
Mm-hmm. So we have about 7 more minutes. So I want to make sure we get Pat to run through anything else that you wanted to ask the group and give you that time. If anyone has any other thoughts, please feel free to throw them into the chat for us to consider too.
Okay, next slide. So Bethlyn wanted us to have pop appeal. So we've talked about how we can do that. And I think Debbie's thought was really good because I wanted to, again, include some of the positive statements that parents have said why telehealth is good. But I find like her, everyone says the same thing. So I've started to parse out maybe unique things that parents have said to be able to to be able to really get more of a something that maybe is a little bit more impactful. And again, tailoring to the audience and keeping that fluid mindset that we've just talked about. Next slide. So just to let you guys know, if I put in some data, and this is something I thought would be pertinent to all, we started doing after our telehealth, the 6 questions that BU had asked us to incorporate. So this is what we have in terms of what parents have said. So in general, the technology has been easy. You can see that clearly people have felt that this has worked for them for their telehealth visits. Next slide. And then when we looked at in-person visits, again, it looks like telehealth is here to stay in some shape or form. Again, very valuable to somewhat is 73%. So again, we've really had a good response to our telehealth. And this again are the 6 questions that BU had wanted us. So I was hoping that maybe I could put those in somehow, or again, incorporate that. Next slide. And again, these are our patients. These are actual patients from the Office for Children. And these children are our audience. This is actually one of our clinics that we have. And then we have a Christmas program and we support the children with presents and things. So next slide. So sticking points we're trying to maintain is, are we going to be able to continue, is leadership going to continue to invest to help us maintain what we're doing? Again, did we create enough of an unmet medical need? That is something that we found with our virtual care team conference, that while we thought it was a great idea, we weren't getting the buy-in from parents that this was the best idea. So really trying to kind of hone in on that. And then again, as I said, now because of everyone doing telehealth, it's become even less of a need. And that means, are we still relevant with our virtual care team conference, which is what we've tried to bring forth. Next slide. And going back to what Meg said, did our projects succeed? That's what I'm asking. We started out with 4, now we're doing 2. Is that considered, and one of the 2 is, again, looking at the relevancy. Could we say we succeeded? I don't know if other teams have done that. If you all started out one way and now you're here, as we did? Is that something that happens with grants like this as a rule, or is it just intrinsic to us losing so many people and really having quite a bit of turnover that things came like that? Is our team better set up for success? Yes, I think that it is, because we've learned to pivot. So the next slide. So we pivoted. We've really changed the way that we think at Ocean. We've definitely looked for opportunities to build valuable partnerships, whether it's through BU, whether it's, as Rhonda said, with the collaboration. We're looking to develop resources, excuse me, that really support as much as we can. And again, we want to tell our story with data, but we still want it to resonate with the audience. So for me, the biggest question is, how do we define what we did if we say we started out with 4, but now we're doing 2?
All right. So when there's been a lot going on in the chat in relation to this. I have a lot of things that I could say, but I'm not going to. I'd like instead for this to be considered by the group. There's kind of this, Pat, there's things here saying that you're really trying to balance, like look at that data and look at you're really mixing both between the data and the qualitative, which you were just talking about. And we are, so a collaborative story uses data and facts. I don't know if there's anyone here. There's a lot in the chat, and I want to see, we're going to have to move on in a moment, but I'd love to see anyone that feels there's something in there they really want to make sure, not just, but it would be nice for the group to hear what your thoughts are as Pat's finishing this up. I see. Feel free, anyone from the chat, feel free to tell us more about what you've been saying here.
This is Jill from
Hi, Jill.
Washington State. Hi. I really like Amy's chat and what she said. I think taking that, especially if you're talking with legislators, is taking that quantitative data to make a statement, quote unquote, and then using that qualitative story to emphasize the why. So if you're looking at what are you looking to accomplish, you're looking to accomplish better infrastructure for telehealth, using telehealth to create better access for families to more equitable services, utilizing, and it takes reflecting with legislators, your state and your legislature itself, and what are their priorities in their budgeting, what are their priorities, and looking at how do you tell that story so that it at least semi-reflects a way for that to happen. And I really, really like how Amy kind of tied those two pieces together.
Thank you, Jill. I think that's the bringing that data alive to tell the why it's impactful and it matters. And that is one way to help make it pop, right? Make it stick. It also does occur to me that you'd be able to use infographics and like visually represent better some of those numbers. And one last thing I'll say, there's some things in the chat too. Debbie suggests, since typically parents are asked to testify at legislative hearings before subcommittee members, it works to find out what best interests the chair of the committee. And I think that goes to know your audience. So not just know generally who you're going to and what sector, but actually know some of the players might actually help if you're trying to influence decision makers in tailoring your message. And that we heard just even recently, we've heard that telehealth is all the rage. Now people need to know how to use it, what parameters around which it matters most to people, and when doesn't it? And both of those are extremely important. So if you found ways forward, you've been really trying it out. And you'll see when you look that there's variability across state teams and the collaborative around how it's been received. because you focused on it in your project, it may be that you were able to get to places of how do you make this actually work well? And that is gold right now in the policy world.
So Beth Lynn, though, let me ask, as I do the impact statement, do I allude to that we started out with 4 and now we're at 2 and then we kind of tiered off? And I mean, how does that?
No, I think what
not-
Amy said is like, that's something that is process is different. Like for that impact statement, you really want to focus more on what you were able to accomplish and the lessons learned in the context of that for the stakeholders. You might run through lessons learned and what happened in the context of the HRSA report, because they'll know what's, and we can talk more about that, but you don't need to include that in the impact statement.
Thank you.
So thank you, everybody. I think there's a lot of good stuff. Pat, if you get to peruse the chat, any other thoughts that people have about that or for your own projects or just generally approaching this, really appreciate you taking the time and pulling that together. And this isn't the end of that for every team. It's going to be continuing to, we want to help support to have the conversation and help figure some of this out with you and hash it out. So please lean on us to do that. And anyone else would be happy to help review and consider it on a higher level. We could engage the NAC and ask them. So there's lots of possibilities for how we can help you all to really take this and get the input to make it really compelling. So now, speaking of compelling, weaving data together to make it pop. I'm going to hand it over to Meg.
Thanks, Bethlyn. I feel like what I'm about to say has already been said and so much better, but I'm going to plow ahead anyway. Next slide, please. So we wanted to talk with you just a little bit about the power of data and visuals. So how do you get the right people paying attention and wanting to know more? One of the ways to think about that, which we've already talked about, is for messages to stick with policymakers. And those policymakers and decision makers and key constituencies can range from the governor and the legislature to other state agency folks, to your hospital administration, to your patients and families, to your peers and your colleagues. I think peers and colleagues are a group that we forget about a lot of the time, and they're incredibly important because in order for our quality improvement projects and our innovations and our changes to really stick, we need buy-in from everybody around us. We all live within the context of an ecosystem that is interdependent and interconnected. And so if you've got a core group of folks who are working on a QI project and they don't engage the folks who are one step removed from that core team, then it's much less likely that the innovations or the improvements that they identify and implement are going to stay, are going to stick, because you need that buy-in in order for that to happen. So don't forget about your peers and colleagues as an audience for explaining why you're doing what you're doing, how you're doing it, how it's going to make their lives better, how it's going to make the lives of the patients and families that they care about better as well. It's really important too, I think, and we've already talked about this, is to pair data with stories. So we find that data engages the brain and stories engage the heart. And one of the reasons why that's important is because for policymakers, whoever the decision maker is that you've targeted, there are finite resources that they are managing. And if you just come in with data and make a great case for why this is a good thing to do, if the next person who comes in after you, who's in competition for those same resources, also engages that decision maker's heart, then they have a more likely chance of getting their project or thing, whatever it is they're championing, supported, as opposed to you who just came in with the data, however solid and wonderful that data may be. So you need to pair those two things. People need their head engaged, they need their heart engaged, and it really needs to feel like it's going to make a difference for someone or something important to them. You have a lot of data. You have data from your family focus groups. You have data from your family surveys. You have data from the work that you've done collaboratively with your peers as part of the CoIIN. You have data and information from the things that you've learned within your own team. And I'm referencing back what Pat was talking about. You've learned about what works, you've learned about what doesn't work. Those things are incredibly important, and those are messages that can be shared. Why would you sort of keep that to yourself in a way that wouldn't help move you to the next place as an organization? You want to try to spread that as much as you possibly can. So one of the suggestions that we have is to try to lead with the most dramatic and important point to capture the attention of those decision makers and those policy makers. And when we say dramatic, we don't mean that thing that happened in the ICU, or that thing that happened in the emergency room, or that thing that happened in the context of that natural disaster. We mean the thing that was most impactful, the thing that was most meaningful. So here's the data around that. And then here are stories from your colleagues, stories from other providers, stories from patient families, stories from patients, if you can get them, about why that thing that you are promoting and championing really made a difference and how it's going to make a difference moving into the future. Next slide, please. So I'm going to turn it back over to Bethlyn, who's going to talk a little bit about Team Texas's experience. But before we do that, I see that there's some activity in the chat box, and I'm also wondering if anybody else has anything that they want to add to what I was just talking about. Tammy, if you are willing to open up your microphone and just share with us what you've said in the chat, I think it's really important. And not everybody is on the computer. I think there are some people who are just here on audio. So would you mind sharing that with the group?
Oh, sure. Thanks, Meg. I think you got to what I was thinking about while you were speaking, but that I have heard some people underplay stories as that's just an anecdote, and an anecdote really isn't data. And so I was just wondering how people, if anybody else has experienced that, where a story is underplayed as in, that doesn't really happen, that's just a one-off. So that was my thought. It's a problem, I think.
I think you're right. And I think that in my experience, what I've heard is, well, that's just one person, right? So that's why you come with the data too, because the data is representing a larger group. The story is illuminating the meaning and the context behind that data. The data is showing the power in numbers, right? And not just numbers in terms of the statistical data, but numbers in terms of it comes from a lot of different sources. It comes from a lot of different points. And so that for me is one way to counter that when someone, makes that suggestion. I wonder if other folks have had a similar experience and if they have any strategies for addressing that, well, that's just one person, or, oh, that's just an anecdote, or being a little bit dismissive of that.
So this is Amy. I really appreciate that comment, because I think that what we have to do is preemptively make them understand that it's not just one story. So the way I think that happens is the way you described, is tying it directly to the data and giving it as an example. And then the other thing that I think we do is, when this kind of comes back to us, is say it's the lived experience of the people we serve, right? So kind of a like, don't you dare forget that these people matter, right? And so I think there's something about like the wanting to just brush off the one-offs, but you're gonna pick information that isn't one-off. You are gonna pick information or a piece of story that goes with the data that's backed up by the numbers. So not only can they not dismiss it because it's backed up by the numbers, you're saying this is not something we dismiss because this is somebody's lived experience, and we don't ever discount that.
Well said, Amy. Thank you so much.
Meg, this is Steve. I just wanted to throw in that it seems like it's important to emphasize that the model of care is what produced the experience and also what produced the data, and is the core, the foundation of what can be done on a broader policy basis. So to me, the model of care that has been organized, and that is really in most cases, the intervention or innovation, is, I think it's sort of the linkage between the experience and the outcome for individuals and the data, because the model in a sense produces the data.
Thanks, Steve. You brought up something really important. And so we've been talking a little bit about stickiness. We've been talking about, you know, you learned something, you made a change, you want that change to stick because you want to continue to get that good outcome that you got. Now we're starting to get into the territory of dissemination and spread, because it's great for your clinic or it's great for your particular environment, but wouldn't you like to see that spread to other places, both within your organization, if it can impact more kids and families and more providers, improve everybody's quality of life and everybody's well-being? Wouldn't you like to see that spread statewide? Wouldn't you like to see that spread nationally? So these are all things that are interconnected with one another and interrelated in terms of the impact statement, in terms of the messaging, in terms of the return on investment, in terms of the value proposition, in terms of dissemination and spread. They are all related to one another. It's a lot, I know, but these are all really important things to be thinking about now as we're starting to come to the end of our time together as a CoIIN. I know that, you know, I could continue talking about this for a while, but Bethlyn has a lot of really good things that she wants to share with you from Team Texas. So please continue to put questions and comments in the chat box. I'm going to turn the microphone over to Bethlyn again.
Great. Yeah, we have a bunch of things we wanted to highlight for you in the context of what we've seen, just to give you some tangible considerations and practical examples from the aggregate CoIIN work and things you might be able to use to help ground that idea of family well-being and quality of life. I think one area, this Team Texas, this came up in the last Care Coordination Academy, is redundancy. That admin burden and redundancy drives everybody crazy and it costs money. So if there are ways to be able to try to capture the ways that you're reducing that, and I remember, Pat, you mentioned trying to reduce redundancy in the context of telehealth. So any way you can kind of pull in some of these things, I think can really, those are aligned outcomes. And this happens to be, I wrote this down, and the Care Coordination Academy organically came up that Team Texas put together this touch points document when their state Medicaid managed care, Medicaid medical director was on a panel and speaking to how to build the collaborations and to come to align and shared messages. His name, I only have Ryan as his name down. I'm sorry, I don't know his last name. I didn't write that in my notes. I'm going to quote exactly what he said. You see here, there are 3 slides of this. Touch points, Team Texas touch points. So they did patients and they showed in the course of a year the touch points for that patient. So you can see here, thank you. That's why I didn't get the last name. I'm not even going to try to pronounce that. It's, but it's Van Ramshort. Okay, I got it. I might be wrong, but you can see here, and then I'm just going to run through the other 2 slides. There's patient 1, patient 2, patient 3. And when you look at this, what do you see immediately? What occurs to you? What stands out at you?
That there's a lot of blue dots?
Yeah, a lot of blue dots. So I can tell you that when Ryan saw this, he said, it is so powerful to see how many touch points occur for these kids in 1 calendar year. No reimbursement is provided for this extra work, and the administrative burden on the MCO is not lined up. That's 1 child with over 200 touch points. This is far more convincing than any letter. And I know that Team Texas, I was briefly while they were talking about this and saying this was actually a happy accident that they were pulling. They purposefully, obviously, tracked this, but they didn't know it would have such an impact. So I would love to give Team Texas a second to just comment. We need to keep moving because we're going to hit 1:30 very quickly, and we have a few more data points that a few more pieces of data we wanted to pull out and for you as tangible examples. But is there anything else you'd want to add about this, Texas, in just I apologize, but a few words?
Yeah, this is Rahel from Texas. Yeah, I think Bethlen, you did make the point. What these points, blue dots show is one, you know, these are contacts, whether it's paperwork that's being signed or authorization phone calls that are being made by the health home. So when you see all those dots in PDN, it's not what the PDN agency does in their own side. They probably have 200 points themselves because they have to touch with multiple, but these are points, paperwork that we need to deal with from the PDN, the plans of care we have to sign, the change orders we have to sign, the different phone calls and forms. So this is just from the health home's point of view. And two other points. One is the fact that these things are coming through the course of the year randomly. It's not like you're sitting down and you are having the PDN and the therapy and all of these issues that need to be handled happening at the same time in a coordinated manner. Paperwork just flies at you every which way for the same patient, just about every week, every month, which is difficult to make any thoughtful anything except to just sign it. The last point I want to make is that all of the things that the upper 3/4 of what we do is absolutely not paid for. All of these contacts are just work. The provider visit is probably the only one that you get paid for. Everything else is unreimbursed time. So again, I think the graph makes the point that this is intense work, a whole lot of coordination and touch points that the health home does, but it is redundant, it is haphazard, it is disorganized, and it is unreimbursed. And the other entities that we interact with are not pulled in a coordinated manner at planned intervals to do all the paperwork and all of the authorizations. They just randomly send the papers and we just sign them. So that's kind of what this shows.
Thank you. And I want to point out a few things in that I think my guess is that you were experiencing that and then you looked for a way to represent it, right? You knew some of the things you wanted to hit that were going on. You just summarized them very well. Then you looked for a way to try to represent it. And I think that is part of the challenge, but this is simple, it's elegant. And so trying to find ways to do that simply is if you know the top things you want to hit, it might help you to then drive how you represent those, what you lead with, and visually make it pop. Thank you. We're going to move on now. Ben.
This is Sandra. Can I say something real quick? I just love that touch point there. I think if we did here in Kentucky something like this for the family to show exactly how much time the family spends on the care of that child that they don't get paid for or they don't get any type of reimbursement for, because if you have more than one child with a complex need, you know, that amount of time adds up to, I mean, with myself, I'm just thinking, you know, with 3 children that I remember all the time I spent on advocating for them for everything. You know, we did the care coordination because we didn't have care coordination. So to me, this is just a wonderful graph. I love it. And I would like to get a copy of this if I could. And that could be something that we could talk about, you know, as our own team. But I really think that if we move in the direction that everybody is talking about having a family members come and speak to the legislators, things like that, I think this would be a perfect graft for that, so that they could really show all the time that they spend caring for their young child, their middle-aged child, their adult children. You know, I mean, because it's ongoing. So I'm really impressed with that. So I just wanted to share. Thank you.
Yeah. I think that's part of what you all experience every day. And that's everyone would be served if there was a way, if people could recognize just bottom line, this is a problem. And I love that. There's a lot going on in the chat about being very, really appreciating the idea of that deeper dive into like the care map. So you're seeing it from both sides too. and really understanding what that looks like. And we can definitely throw these into, I know Team Texas has been very gracious about sharing this. We can create a like that sustainability, like visual representations folder and throw it in there for you under state team materials, and be sure to follow up and have you have that information available. So we're going to move on from this. Very grateful for allowing us to use it. I'm going to turn it over to Ben.
Thanks, Bethlyn. I know that we're running a little low on time. I don't know if maybe I should just try and make my first point here and we could send the rest and follow up if you think that makes sense.
Yeah, I think that might be good because we would like to get to the final months. We've had this been such a good discussion. It's hard to keep on time. Thank you.
Yeah, okay, so I'll just do the first thing I was going to talk about here, which is the unmet needs data, but I wanted to take a little bit of time to talk about the family survey data, mainly because not only is the data points that we picked out, do they speak to this like popping? I think we picked some data points that really pop, but I also think that they kind of illustrate how you can use the survey data to kind of guide your story and then bring in that subsequent qualitative information in the family stories that we were just kind of talking about. And I think this really speaks to that. And so the first thing I was going to talk about is the unmet needs piloting. And so you might remember that we were hearing from you, the state teams, and from family leaders that what we were getting on the family surveys in terms of families reporting that they had no unmet need, it was just not matching what we were hearing in the family focus groups and from family stories. So we took that feedback and we developed this pilot question over here on the left. So it started as this, the original question was the two-part first question, do you have any unmet needs? And then the second, if so, what were those unmet needs? And you wouldn't even see that question if you answered no on the first question. So we changed it to this question over here, which just leads with asking what those unmet needs are. And we had some state teams graciously agree to pilot this question for us. And this is preliminary data that I'm showing you on the screen here. So you might actually notice that the little Minnesota dot is in cycle 4. So we don't actually have cycle 4 data from the states yet, but this is something we're able to just pull out of KEDA and see where it's going. And I think that it's already going somewhere. So you can see the blue line here is the families that are responding to the original question. So do you have any unmet needs? And it's kind of been for the first 3 cycles at the network level, it's been hovering around 90%. And that was the number that we were confused why we were getting that number, right? And so then when you look at Team Texas and Team Minnesota over here that are piloting the question, you're seeing a completely different story. The families that are reporting having no unmet need, there's less than half as what we were getting before. And so I think this is an important learning for the network because we learn how we ask this question of families really does matter. But I think it also is a data point that's leading to that qualitative data that you're getting from families and the family stories. That's something that's really important, and that's what's actually getting at family unmet need. And that's what the decision makers in your state are really going to want to hear about, and what kind of speaks to why the work that you're doing is so important. There was a couple other questions I wanted to chat about, but I think this one was the emerging one that was really important.
Ben, do you want to just show them just so that we can, when people have like something in mind when they see them after?
Yep, so this one was a quality of life question just about the families who were responding if they felt that the clinic knows and values their child. And so kind of the takeaway here was when you're looking at those who had this original response of almost always or usually, and that's what we were normally looking at. When you bring in just the people who are marking the highest response of I almost always feel that the clinic knows and values my child, that's when we're seeing almost a more compelling story and looking at this orange line here that's jumping from 65% to 77% from cycle 2 to cycle 3. And I think the kind of takeaway there is just looking at your data and figuring out what you're seeing, because this is the network level data, right? But your state data is going to look a little different. So maybe your blue line isn't quite as high, but are you seeing a bigger jump? So where is that story based on what's happening in your state?
Great. And then we also have the medical home, and then the next one is telehealth and considerations around how you might use that. And you can see there's a lot of variability here depending on what teams we're doing in that domain. So a lot to consider around those questions because there's a lot of interest in those right now.
Yeah, and that's the same question that actually Team Kentucky showed earlier too.
Yeah, yeah, great. So Ben, are you okay if we move on then?
Yes, you all have access to this data too, so I'll make sure when we send in follow-up that you're able to see it.
Great. Meg, I'm going to hand it back over to you, and then we're going to try to squeeze in our next steps before we're done.
So everybody can read this slide. I think that we have talked about over the course of our time together today, but also in both, verbally, but also in the chat box, a lot of these points. Keeping your audience in mind, making sure that what your goal is to make sure that the quality improvements that you have identified and initiated and measured and tested against really do stick. Using qualitative and quantitative data with families' individual stories. We put families in here because obviously that's the core and the center of everything that we do, but I think provider stories are really important too. Don't limit yourself to just our CoIIN data sources. Use everything that you possibly can. And then the utility of the CoIIN aggregate data is for you all to measure yourselves against the entire network, but your individual data is really what your local folks are going to be interested in. They're not going to care as much about what 10 state team results were. They're going to really care mostly about what your individual state team's results were. And then, there's just a reference here to a publication that we drew this from the Catalyst Center. Let's go ahead and switch to the next slide. And then I'm going to turn it back over to Libby.
Thanks, Meg. I'm going to just go over a few activities that we have, activities and deliverables that we have for the remainder of the CoIIN project through the end of July. So this slide here just shows you the things that will be continuing to be ongoing through the end of the project. And a lot of these are pretty familiar to you already. You'll be continuing your coaching calls. We have our monthly state team updates. One note I want to make is that we will be continuing to collect data through the end of April, which is the end of cycle 4. And we'll be focusing on sustainability and dissemination as well. We have tons of technical assistance opportunities that you can take a part of. We have some required meetings and webinars, but the rest are optional activities that you can take part of in whatever would be the most helpful. One note that I do want to make about some of our upcoming meetings, we have a 2-day meeting planned in July for a learning session that we were hoping to hold in person, but due to the ongoing pandemic and the fact that the AAP space will be closed, we will be hosting that virtually. So we'll be sending out a formal communication about that, updating the calendar invitations and everything, but I just wanted to make a mention of that here. And then just to go over a few deliverables that we have through the end of the project, you can see that we have them spread across the rest of the months remaining. So some of you are still going to be completing your key informant interviews by the end of the month. Like I mentioned, in April, we'll be ending the cycle 4 data. And then in May, that data will be due to BU. So we'll be following the same process that we have throughout the rest of the project. We have a few things that will be happening in June and July. So we'll be conducting another round of the FESAT that you'll be doing with your team, and the plans will be due for that at the end of June, as well as a 3rd round of the family focus groups, and then really your first draft of, or close to final draft of your impact statement and state team chapter are due at the end of June. Those will then be refined and we'll work with you, the BU team and the other CoIIN leadership collaborative partners will be working with you to really refine that chapter and have the final draft due at the end of July. So that's just an overview. We do have a document in the state team materials folder under admin that lays all of this out with specific dates, all of the TA dates. It's sort of a one-stop shop for everything that's remaining. And I am going to turn it over to Meg to just talk briefly about some of our open office hours coming up.
Thanks very much, Libby. So many of you have had questions about the roll up to the end of year 4. And in common with our colleagues at HRSA, we have some more information for you about that. And we will be sending that to you in the next day or so by email. We wanted to make sure that everybody got the same information at the same time. So that's why we're sending it out by email. We'll send it to state team leads and the folks who are on our primary distribution list, but you should feel free to share it with your entire team. And then we've planned 2 opportunities for open office hours, because I'm sure folks will have lots of questions after they get this email. And so we have one scheduled for March the 26th at 12 o'clock Eastern time, and one scheduled for April the 9th at 2 o'clock Eastern time. You should feel free to drop into either one of those. There's no obligation to drop into both. And anybody on your state team, including the state team leads, but anybody else who's involved on your team is welcome to join those open office hours. And we're very much hoping to be helpful to you during that time. Let's go ahead and switch to the next slide. Please, please, please complete the evaluation. We really do use the information to help improve future webinars and technical assistance opportunities. So please take just a few minutes to do that for us. Continue working on refining your impact statement. Reach out to us with questions. If we can sit with you and with your QI coaches and think through your impact statements together, we are more than happy to schedule that time and do that. And we are very much hoping to be helpful to you as you continue to refine your messaging and as you continue to analyze your findings. Bethlen, let me go ahead and turn it back to you. I believe the evaluation link is in the chat box. Is that right? Give me a vigorous nod if that's right. Yes, okay, lots of vigorous nodding, great. Okay, all right.
Good job with the vigorous nodding, people. Thank you. We are a few minutes over time. So grateful for the discussion. This conversation is a testament to the dedication you all have, and we look forward to helping you to share this out. I think Barbara had a question about, will we be able to share all the impact data reports with everyone? And I misunderstood what she was saying. I think if folks are willing, I think it would really be helpful to everyone, even if you share drafts as you're going. I just think this particularly, we're all in this together. The power of the collaborative will make a difference for this, for all of us. So thank you. Thank you everybody for being here, and be well.